So this is Natasha Mitchell, and I am presenting pneumonia. This is a picture of me and an introduction on my nursing background. Our objectives today are to define what is pneumonia, identify the pathophysiology, high-risk populations, signs and symptoms, diagnostic measures, and treatment options available. What is pneumonia? Pneumonia is an infection that inflames the air sacs in one or both of the lungs. The air sacs may be filled with fluid or pus, and there are a variety of organisms that can cause pneumonia, including bacteria, viruses, and fungi. This pneumonia can be mild to life-threatening depending on age and risk factors. Pathophysiology. So this is what's going on in the body when you get diagnosed with pneumonia. So you have a breakdown in your body's natural defense. Germs invade and multiply that area, usually the lungs. White blood cells accumulate and air sacs fill with bacteria and fungi. And the most common cause of a bacterial pneumonia is Streptococcus pneumonia. Who are our high-risk populations? This is going to be children under the age of 2, adults 65 years and older, smokers, history of hospitalizations. So these are people that have hospital-acquired pneumonia or the healthcare-acquired pneumonia, and also chronic disease process people, COPDers, people that have asthma, CHF, diabetes, stuff like that. What are our signs and symptoms going to be for these patients? Usually they have fever, they have a cough, it could be productive and it could be thick yellow sputum. They can have chest pain when breathing or when coughing. They can have chills, sweating, shakes, shortness of breath, and fatigue. And these people usually say they feel like they've been hit by a bus, just very fatigued with activity. They can't hardly even walk from point A to point B without getting short of breath, and they can also have nausea, vomiting, diarrhea with this. So what are our diagnostic measures going to be? We're going to check that CBC so we can see what their white count is doing. That'll tell us how bad their infection is. Also, we'll do a chest x-ray so we can see the pneumonia. We may do a sputum culture so we know exactly what type of bacteria we're dealing with. And we're also going to look at the vital signs and see if they've got a fever. Is their O2 sat low? Are they tachycardic? Also, we want to listen to their lungs. What do they sound like? Are they diminished? Do we hear crackles? Stuff like that. This is a picture of a patient with pneumonia, and you can see where the arrows are pointing, and it looks whited out to where you see the pneumonia. What are our treatment options going to be for these patients? They're going to get some antibiotics, and they're usually going to get a broad spectrum antibiotic because we don't know right off the bat what kind of bacteria or virus or fungi we're dealing with these patients. Antipyretics, that's going to be your Tylenol, Motrin. Nebulized medications, some albuterol, Xopenex, kind of open up those lungs, let them cough all that stuff out. Pain medications, this could be for patients that are just having a lot of pain with coughing, and it'll also relax them so they can cough and get that yucky stuff out. Some steroids, and also besides giving medications, we can do things like incentive spirometer, to where they're opening up those alveoli, able to cough up stuff. We can do chest percussion, stuff like that. So here's our summary. Pneumonia is an infection that inflames air sacs and lungs. Our high-risk populations include children under 2, adults over 65, and people with chronic diseases. Our signs and symptoms include fever, chills, cough, fatigue, and chest pain. Diagnostics include lab results, radiology, studies, and clinical presentation, and treatment options, medications, and respiratory. Does anybody have any questions? is my reference, and thank you so much.